Hello, welcome to my YouTube channel. So today I just want to talk about some tips that may help you get through some of your days for your first job. Hippocrates is great for decision-making support. It's a big help when it comes to prescribing medications, correct dosing, explanation of how the medication works, what's the best treatment for certain disease conditions or disease states. Hippocrates helps a lot with decision making using evidence-based practice. Up to Date is a very informative in almost all disease states. It describes the pathology, it goes over signs and symptoms, diagnostic studies that you can use to narrow it down, treatment modalities using evidence-based practice as well. This Up to Date can be very informative with helping you with your decision making. Medscape, it's very similar to Up to Date, except that the information is extremely wordy. It can be very difficult to narrow down what it is that you need to be doing in a particular situation, but it's a resource. The first two, Hippocrates and Up to Date, I would try to tuck away in my back pocket. It can be very, very helpful. Make sure you know some of the basics. Studying for your boards alone should help you with some of the basic information that you need to know to practice as a nurse practitioner. But if not, check out the Maria Leakes review book. I think she saved my life during my first year. I used her to study for my board. She provided a lot of information that I did use during my first year, and even now I still use it, but very good information. So I'm gonna go over some disease states that you should familiarize yourself with, learn the presentation, common diagnostic studies, treatment modalities. You can make cheat sheets for some of these disease states. You might not remember everything, but at least if you come across it, you'll have an idea of what you want to do about it. For example, like what antibiotic you might give for an ear infection, how might you treat a throat infection. Just look up the treatment modalities for these common things, and it'll help you with your practice during your first year. So some primary care outpatient common conditions you may come across include hypertension, COPD, asthma, the common cold, influenza, seasonal allergies, pharyngitis, skin problems, EKG management, chronic pain, leg pain, conjunctivitis, ear infections, sore throat, cellulitis, UTI. These might be some of the common things that you encounter in primary care. And knowing how to manage some of the chronic conditions as well, diabetes, I mentioned the hypertension, high cholesterol, things like that, you want to know how to manage as well. If they're already on metformin, if they're diabetic, okay, what's going to be my next step if their blood sugars are not, or their hemoglobin A1C is not controlled? So those kind of things you want to stick up in your back pocket so that you know what to do when the patients are coming in. Hospital inpatient common conditions include chest pain, syncope, MI, CHF, atrial fibrillation, pneumonia, shortness of breath, COPD exacerbations, asthma exacerbations, nausea, vomiting, GI bleed, diverticulitis, diarrhea, abdominal pain, hepatic encephalopathy, liver cirrhosis, ascites, back pain, renal colic, hematuria, TIA and CVAs, seizures, headaches. Altered mental status is a big one. Every day someone's coming in with altered mental status all day. Subdural hematoma, hip fractures, post-op patients, knee replacements, fevers, UTI, cellulitis, abscesses, acute renal failure, anemia, malignancies, hyponatremia, hypernatremia, hypercalcemia, hypoglycemia, DKA, and many, many more. But if you can, start looking these things up, seeing how, in which way you want to diagnose these things and treat these things, it could be a big help to your practice. So just be familiar with some of these common disease states. It can help you get through your first year drastically. For me, I developed a plan. When I came in my first days and I had no idea what I would do when my patients were presenting with certain modalities. It's like, okay, what's next? All right, I would have to sneak and kind of look it up and see what would be the treatment plan. And so that kind of egged me on to come home. I made a few cheat sheets for myself on how would I treat a common cold when they come in with the flu. I know I'm going to give them Tamiflu. I memorized the dosage, 75 milligrams, so I didn't have to keep looking it up when I wanted to write the prescription. UTIs, how do I want to treat that outpatient? What's going to be my first line unless they have an allergy? Pharyngitis. I knew that penicillin was the first line treatment for pharyngitis. You also might want to develop a plan B for if they have an allergy to penicillin. But I had all of this written down because as a new NP, I couldn't really remember, okay, ear infections get treated with, amoxicillin, or, sinus infections get treated with penicillin as well, or augmentin, one or the other. But, using Hippocrates, I would look it up and write down the recommended or the evidence-based treatment modalities for these conditions. So I didn't have to keep looking it up. You do want to, know what you would do if your patient is diabetic and maybe they're already on metformin and you want to know what's next because their hemoglobin A1C is not controlled. What will I add on next? So I had those plans written out for myself, and every day you'll learn something new from either the patients or the doctors, and you just add on to your skills every day. But in the beginning, you have a hard time just figuring out what will I treat this with. So make little cheat sheets for yourself. Use Hippocrates. Hippocrates is a big help when it comes to prescribing and treatment. You can look up pneumonia. It'll tell you how to treat it inpatient, and it'll tell you how you'll treat it if it's outpatient. Inpatient care and outpatient care are two different things most of the time. You treat it two different ways. So depending on your setting, you want to follow evidence-based guidelines, and Hippocrates will help you big time with that. In the first year, I paid for the subscription. It was $150 for the year. I don't pay for it now because I don't need it to that extent, but I couldn't imagine having it any other way for my first year. I had full access. If I looked up pneumonia, it would tell me how to treat it. If I looked up hypertension, it would give me some evidence-based guidelines for adding therapy or taking away therapy. With the blacks, African Americans, the thiazide medications work a lot better in that class. If in the elderly, if they're having isolated hypertension, you want to go to the calcium channel blocker that works for that. So, Hippocrates helps a lot. If you look it up, they'll give you just this information I'm telling you. And I try not to come on YouTube to teach you how to treat disease states or modalities. It's important for you to look it up. That's the best way to practice. Look up evidence-based practice. Because I talk about sinusitis and pharyngitis, I could easily be just turning around the antibiotics. Maybe pharyngitis gets augmented, but I believe it gets penicillin, and I believe sinusitis gets augmentin. But it's something that you would want to look up and make sure you're prescribing correctly and treating correctly, I would say, based on evidence-based practice. Okay?